Yeah, so I'll be giving, sorry, a brief overview of a paper that I collaborated with Robbie Dushinsky and others from our former research group at Cambridge, which is the 6 attachment discourses: convergence, divergence, and relay. So this paper draws on one of the themes that Robbie Dushinsky describes in his book, Cornerstones of Attachment Research, which basically analyzes the field of attachment research, the work of 5 important research groups that contributed to developing and building the field. So for this paper, Robbie collaborated with me and other members of our group at Cambridge. So the paper describes ways in which different attachment concepts, such as attachment security, trauma, and so forth, are used across different domains of attachment discourse. And these, the ways in which these concepts are used are often not recognized, and this may cause confusion in communication between the different domains and between different groups of people, such as researchers, clinicians, and also the general public. And so some of these concepts even have contradictory meanings. And all this confusion well, you can imagine that it doesn't help collaboration between different groups. So I'll illustrate these 6 discourses very briefly, and then we'll go deeper into the differences between some of the discourses and providing examples from research. So I'll start with developmental science. So you'll have seen this photo of Mary Ainsworth. So this discourse of attachment research stems from the early 1970s. Starting with Mary Ainsworth's research group, and other important groups followed in the decades after the 70s. So a group in Minnesota led by Ellen Sroth, and a group in Berkeley, California, led by Mary Main and Eric Hesse, who developed the adult attachment interview. So this discourse relies on observational measures of attachment, such as the strange situation that Carlo talked about in his presentation, and also the adult attachment interview. So these observational measures, they allow for assessment of very subtle behaviors of attachment research, and these measures are time intensive. And they have been used a lot during the last few decades in many different studies. So this discourse is also seen by many in the field as symbolic authority in the attachment field. And this has been criticized by other groups, such as social psychology attachment researchers. So the field has focused on mostly clinical correlates of attachment behavior, such as social competence and internalizing and externalizing problems. This may be perhaps because of Bowlby's legacy as a clinician working with children and adults. So then there's the social psychological attachment discourse. So this is a field that developed somewhat later in the late 1980s. And the social psychology discourse conceptualizes attachment relationships as adult relationships and romantic relationships. So the field has been shaped by social psychology researchers. So Schaefer and colleagues, they developed a self-report measure to explore individual differences in attachment. So these were first called attachment styles, categories of an anxious attachment style and an avoidant attachment style, based on a self-report questionnaire. So people were asked questions about how they behave and how they think about different relationships. And later, Brennan and colleagues, they identified attachment anxiety and avoidance as two different dimensions. And they are measured with the experiences in close relationships scale. And here I've shown some examples of items. So you can, if you Google it, you can take the test online, and then you can see like to what extent you have anxious or avoidant attachment. So research in social psychology, attachment research has mostly focused on validating these concepts of attachment anxiety and avoidance by seeking out correlates of these concepts. And attachment anxiety and avoidance are conceptualized as being like outside of the person's awareness, and they are thought to shape attitudes and behavior and perceptions, but mostly outside your awareness. So then there's popular attachment discourse. So in the 1950s, Bowlby already wrote to popular audiences, but today we are also seeing many examples of popular attachment discourse. And I thought it would be more interesting to show you these examples. So like a while ago, I stumbled upon this piece in the New York Times titled, "Are you anxious, avoidant, or secure?" And it was an article about this book, Attached, that has been published about 10 years ago. So I don't, this Google picture should have been over here, but it's not part of the book cover. So this book has been published about 10 years ago, and it's like a kind of self-help book about how you can maintain romantic relationships, like how it can help you find and keep love. So it's very compelling to people. So I haven't read this book, but it's really, it's really popular, and it basically claims to have to be like groundbreaking and having found like a new way of thinking about romantic relationships. But actually, most of the research in this book is based on research from the late 1980s, from the social psychology domain. So that's what I found a bit interesting. So you can see like the little review on the cover, a groundbreaking book. Well, it may have been groundbreaking in the sense that it is very popular and appealing to a lot of people, but it's not really based on new stuff. So attachment as a concept, or anxious and avoidant attachment, has been viral on TikTok. I am not on TikTok because I don't think I'm like the target population. I'm a few years too old, but it's gone like really viral with TikTokers telling people about their experiences with romantic relationships. And then this girl, for example, realizes she's moving from an anxious to a secure attachment. So it can be a fluid concept. I don't know. So that's popular attachment discourse. But it doesn't have like much to do with the developmental tradition of attachment research. So then there is attachment discourse in psychotherapy. So this discourse draws from insights of theory offered by the developmental tradition. And it has a long tradition too. So from the 1990s, many texts have been produced with a psychotherapy audience in mind, and Bowlby has also a clinical background, of course. And from the 2000s, this field further developed, and guidelines for psychotherapy were more based on empirical research with patients. So in this field, attachment theory must help to make sense of problems that people experience. So it has to make sense of psychological distress. And it also needs to give the impression of evidence-based practice and science. So an interesting difference between attachments as a concept in this discourse compared to other discourses is that attachment security is not conceptualized as a correlate of mental health problems, but as a mechanism. And that's a big difference. But Orwell may tell you more about this in his talk, I think. So going to the next one. Attachment in psychiatric diagnosis. So attachment also entered the field of psychiatric diagnosis, also in the early 1980s. And then reactive attachment disorder was included in the DSM-3. So the DSM is the Diagnostic and Statistical Manual of Mental Disorders. So attachment as a diagnosis. So there have been some revisions in the diagnosis since its introduction, but in the DSM-5 today it is defined as a trauma and stressor-related condition of early childhood caused by social neglect and maltreatment. And there are a few criteria to diagnose reactive attachment disorder, but I don't think we'll have time to go into this much further. It's good to know that there has been growing concerns about a reactive attachment disorder as a diagnosis. Concerns that it is over or underdiagnosed, and there are problems in the conceptualization of insufficient care, like that's one of the criteria to diagnose reactive attachment disorder. Something interesting about this discourse is that it doesn't have much in common with the other discourses. How Robbie Dushinsky described it, only the word attachment it has in common with the other discourses. Mostly because it is difficult to examine how the category is associated or relates to other discourses because of conceptual things that are not clear, such as the meaning of insufficient care, which is hard to define. So then the last one, as described in the paper, which is attachment discourse in child welfare. So what attachment theory offers welfare professionals, such as child and family social workers, is that it is a framework that may help them to predict outcomes about children's health or mental health based on observable behaviors of children and their parents. And it treats the attachment categories as quasi-diagnostic. So reactive attachment disorder is a diagnosis in the DSM, but the Ainsworth categories in the strange situation procedure are not. They are not regulated categories, and they are used in research. And they require specialist training to be able to code them. But regardless, it treats these categories as if they were diagnostic. So another characteristic of this discourse is that social welfare professionals have been encouraged also by policymakers to compare parent and child behaviors with secure attachment as a reference category when assessing the quality of parenting. So secure attachment is good, and insecure attachment maybe not so good. So in this discourse, attachment theory is used as a framework to make sense of complex situations with children and families, and to assess risk, and to also inform next steps in child and family care. Something that may be a bit that is a bit difficult is that welfare professionals don't always know how to use attachment concepts and categories, because often they haven't received specialist training in relevant measures such as the strange situation. So yeah, that's an overview of the six discourses in the paper, and I'll be giving the floor to Or. Oh no, I'm not. There's another slide. Sorry. Oh yes, I added it as an illustration of differing meaning of the word of attachment security, which maybe if I have 2 minutes left, may be interesting to discuss. So attachment security in popular attachment discourse is presented as a desired state for everyone, a good and confident psychological state which you need to strive for. So that's something you would like to have, attachment security. In developmental science, it is conceptualized as the availability of a safe haven in attachment figures, such as parents. Whereas in social psychological science, that conceptualizes attachment as anxiety and avoidance, secure attachment is conceptualized as the absence of anxiety and avoidance. And in psychotherapy, it is conceptualized as the mechanism of good mental health in the therapeutic relationship, and also in other interactions that clients may have. And in child welfare practice, it is conceptualized as good parent-child relationship, and everything in the child's best interest. So there is some overlap, but these concepts are very different from one another. So this is just one example.